Hi there, this is Dr. Brad Makimaa with Southernmost Foot and Ankle Specialists and UrgentFootCare.com. Today we're going to talk about ankle sprains. More so we talk about ankle injury. Most people call it generically an ankle sprain, but what really is an ankle sprain? There's a lot more to it, and most of the time, most of the diagnoses we see are not actually an ankle sprain. We're going to start with some x-rays, and with the x-ray we're looking at a lot of different areas, but we'll go to some anatomy. Come on in here. And first of all, on the ankle, okay, ankle sprain traditionally would mean you tore one of the three ankle ligaments here, or on the back side. There's also high ankle sprain, which can involve the ligament here or the membrane running up inside here. There's also fracture of the fibula, could be right here. We look at the anterior process of the calcaneus, you could fracture it here. You could injure the bifurcate ligament, or any of the cuboid ligaments here could be injured. The fifth metatarsal base could have a fracture or a tendon injury. The peroneal tendon could have an injury here or along the body of it. There's so many structures in here that we want to evaluate closely. Where's your pain? Where's the black and blue? Where's the swelling? Because there's multiple anatomic structures in that area and it's not always a sprain. So we look at the x-ray. Here's an example here where there's a fracture of the fibula here, all through here, okay? There's some old injury over here, which healed with some excess bone. There was a previous high ankle sprain where the interosseous membrane was injured here. Here's a lateral view. We'll see a fracture right across here. So a lot of different things that we're gonna look at. Specific, is it a fracture? Is it a sprain? At what extent do you have? And based on that, could be as small as a little ligament injury, needs an ankle brace, some rest, or is it a fracture? Does it need a big boot? Does it need surgery? Does it need crutches? So between surgery and crutches or a boot, and you can walk on it down to an ankle brace, based on the level of what you have. We'll end up with some rehab, certainly strength, balance at the end of all of this. But number one, most important with an ankle sprain is what really is the diagnosis. So we'll look at you, we'll look at your x-rays, and I hope you learned a little bit more about ankle sprains, and we'll dive into it closer shortly.